with any vision therapy program, there has to be some at-home component where a patient is at home, they're trying to get better on their own. They need to put in the time, the effort, and sometimes that's a struggle. Kids get home from school, parents have a busy day, and it's really hard. Having something that they can do for 5 minutes on their computer really helps. It's not something extra. It's not a handout. It's not a piece of paper that they want to crumble up and throw in the garbage. It tends to be less of a struggle because the kids want to be on the computer. They want to be on their electronics. So allowing them, hey, if you finish this 5 minutes of the eye trainer, then you can go ahead and watch that YouTube video. So it really is the new way of learning. That's the iPads, the computers, the iPhones. This is what we have in our hands at all times. So we need to use this technology to help kids get better. And, we got to bring it to where they are, and that's where they are. Just today, I had a child that didn't want to do their therapy. They came in kicking and screaming, as it happens sometimes, and they know we have the right eye games, and they do like the games. So we left as a reward, when you finish the tasks we need you to do, that you can go ahead and blow up some spaceships with your eyeballs. And that motivation was enough to keep them going, that by the time they got to the end of their session, they forgot that was the goal, but they jumped on it. They really enjoyed it. So it was a pretty good day, and that just happened this morning.
It's kind of like we have some tests where we ask patients to draw things, and sometimes I say to them, you're kind of drawing what your vision problem is. So here it's their eyes essentially are drawing what's going on, and they know I didn't make it up. They know that I didn't change anything while they were doing it, so that they're able to easily know that really was what was happening. And sometimes they go, wow, I didn't even feel, that my eyes weren't working, or, that anything had shifted while I was doing it. And, they know what it roughly should look like. I mean, they know what smooth eye movements should look like, assuming you're just graphing it out.
If you go to the gym once a week, then that's great. But really, if you go to the gym or able to, even if it's for shorter snippets of time, you can do that 3, 4, 5 times a week. You're going to get faster results. You're going to get better results. And so being able to have exercises and such that specifically drill down on that specific need, and into whether it's pursuits, saccades, fixations, reaction time, and so on, and have the patient be able to work on that at home for short periods of time, but on a more consistent basis, you're going to get better results.
When I would have patients do the Brain Health IQ, I would have them do it, and then I would pull up the results in another room and kind of look at them myself before I would discuss it with the patients. But once they've done it a few times, they're anxious. They know what to look at. They're explaining it to their significant other if someone comes in with them, and they want to know their score. And they're a lot of times calling themselves out if they don't do better, or if they do worse. They say, well, it turns out I didn't do my training, like I should have, or they correlate it to, well, I did feel worse yesterday, or yesterday was the first day I went back to school for the whole day instead of a half day. And it really helps to connect those dots for them, because as a patient myself, even though the neuropsychologist that I work with and the DO that I work with, I know the protocol is, if you have a head injury, you should be resting, right? But being the worst patient myself, I didn't always do that. And it was even great for me to be able to then look at my results the next day when I know I overdid it and say, okay, so yeah, it is actually negatively affecting me. And then I take a day off. I'm a little bit more light with what I do. And then I come back and I do better on my testing.